I don't think it's the Kahoots. I think that it's like your computer.
My computer? Are you still hearing it?
Yep.
Sounds like papers, a whole bunch of papers.
Because there's no noise in my background.
Is there something on your speaker?
No, in fact, I just took out my earplug to see if the earplug was causing the issue.
Actually,
Yeah, yeah,
It's better.
it's better. Yeah.
Sounds better now.
Okay, then I'll just have my earphone out. Not a problem. If you can work with it, so can I. All right. Thank you for letting me know and not just going on and just dealing with it. Appreciate that. Okay. And Jasmine went to top. A parent recognizes that toddler has a speech delay compared to the older siblings. What is your priority? What do you think this child needs? Is this normal? Do they, speech delay? So if we are seeing a toddler, they should be able to say at least mommy and daddy and 1 and 2 word sort of sentences at the early part of toddler. So if they're not, we need first of all get the hearing checked, because the hearing has a lot to do with the speech. They can't hear words, they cannot pronunciate, they don't know the words. A multi-select. What are signs of an early indicator of impaired cognition? So cognition, that's the ability to be able to do things, right? Understanding things. It's, going in those sequential trends, going up those ladders. So if they are not talking by 1-year-old, they should at least say mommy and daddy, right? If they're unable to grasp objects at 7 months, they should be able to transfer rattle to rattle at 7 months. And if they're older and they're not behaving, it's because they can't hear, or sometimes, or it's because they don't understand what you're asking for, and that's cognition. A child is being treated for a fever. The reason for treating the child's fever is what? There's a lot of wives' tales about fever and why we treat fevers and big fevers and how bad they are. And actually, all we treat the fever for is the discomfort. There is no life-threatening complications for having a big fever. It is when you have no fever and then you go to a big fever really quickly. It's called the rate of rise. You go from 99 to 102, and then you have those seizures. Usually, when you already have a fever, you're actually safer. So why do we medicate? Because when children have a fever, what do? They lay down, they don't drink, they don't eat, and you could see they don't feel well. You give them Motrin, Tylenol, and all of a sudden, in a half an hour, they're up and running around and they're drinking, which is what you need to do for a fever, and eat. Separation anxiety in a child hospitalized, which behavior indicates a stage of despair? I think going into a hospital is the hardest thing for your young children. Your parents can't be there all the time. And that's what separation anxiety is all about, that those parents aren't there. So there's different levels of despair they go through. So they go through screaming and yelling, then they get to the point where they're sitting in the corner, sucking their thumb again, or maybe they have their blanket or toy and they're just holding it. They regress. And it's part of them saying, I don't like mommy or daddy not being here. A child with a history of abuse, which therapy explores emotional problems? You know, children don't know how to express what happened to them. They don't know good or bad what you want to hear. But in play, we can see what's been going on. And they say that's play therapy, and it's also, you can do it that dramatic play where they're showing you what has been going on. So in play therapy, there's a lot of great things that go on, where they're, you know, taking the child and showing them what's going to happen to them in a procedure, or it could be them telling you what happened to them. And it's non-threatening. Kids don't mind it at all. So in helping a child to adapt the hospitalization experience, the best approach is what? And the big thing is to keep them on the same routine. I mean, yes, you want to bring toys or food from home or their pillow or their special jammies, whatever, but keep them on the same routine. When do they get breakfast? Try to get the same foods if possible, you know, nap time, bedtime. Try to keep them on that same schedule, and children do a lot better, especially toddlers. Assessing vision on a child, the healthcare professional would use a Snellen chart. At what distance do you use it? So it is at 20 feet. And really, children can read these charts, but they would be in different things. Maybe an animal, maybe a color. Depending on the age, they could tell you, what was on the chart. What is a 3-year-old's biggest stressor of being hospitalized? 3-year-old is like the end of the toddlers, beginning of preschoolers. And it's mommy, daddy. They want mommy, daddy, whoever their person is, grandma, grandpa, whoever is their, main caregiver. It's because they have to go, maybe go to work or take care of another, happening, another child, something. So that separation is the biggest stressor, because who are they going to trust? They're scared. A multi-select. What is the best way to alleviate the stress and anxiety of a hospitalized child? So keep the same routines, absolutely. Of course, explaining those procedures developmentally appropriate, and even playing if you need to, but having the parents stay there is number one. There has been many thoughts about the invasive procedures, but they feel that the hospital room, their bed, should be a place where it's safe. So they like to take them out into the treatment room and do those, starting an IV or put an NG tube or catheterize or whatever. A nurse recognizes a family is different from her own, and the lifestyle choices are not ideal. What would you do? Working in the emergency room, you see a wide variety of types of people. And, they may not look the way you like, and you're wondering about the child, but, they brought their child to emergency room. They're there to care. They want their child to get better. So you need to respect those differences, and remember, you're there for the child, to get the child the care that they need. A nurse notes a string tied around an infant's wrist. An appropriate nursing intervention would be what? So before you do anything with this string, it's like, what is that? And why is it there? And it's usually some spiritual, some belief, something they believe is going to protect, their child. So ask first. And if it's not, cutting off circulation or anything, it's fine. Leave it there. It's not hurting us. You know, there's many things. I know in South Florida, they have these little, you know, cat's eyes, this little black and white eye. In fact, I was given a blue and white one by a family member. It was to ward off evil thoughts. They didn't want anybody to envy or have evil thoughts towards the child. And they gave one for me. So I would be safe too. How can a hearing impairment develop? So it could be there at birth, could be some missing part of the ear. You know, the canal may not be there, the earlobe may not be there. It could be from chronic ear infections, illnesses that goes on, and other things can also cause the ear. So a little bit of anything. It could be prematurity, where, you know, you've given those medications, the aminoglucosides with the SINs, and part of the side effects is hearing, right? So maybe they got some issues from the antibiotics. So it could be all those. What urine collection method on an infant is most accurate? Infants come in and you know that they have a fever and you believe it's the urine because it smells bad. How are you going to get the best urine specimen?
Rich, where you come from? Raggedy ass.
And believe it or not, when we talk about infants, the best way, and it should be the first time that they come into the doctor's office or the emergency room, is to do a straight calf. And you think that's a little bit, you know, aggressive, but it's, you know, you clean it good, you have the parents holding the child, you make it more distraction, you put it in, it's like a little uncomfortable, but it's gone, it's out. You've got an accurate specimen, which means you've been placed on an antibiotic, and then you get the urine specimen back and you know if that, antibiotic is appropriate or not. So they don't do bags or clean catch on infant. They do a straight calf because we don't want that urinary tract infection to continue. We want to make sure we got it the first time. A multi-select. What is the purpose and function of the family? We talked a little bit about this, you know, in week 1. So safe environment, they can grow and develop well. That emotional comfort and identity is when they're not there, they're stressed, right? So that's the comfort. And we know the family gives and transmits all their culture, their values, their attitudes and beliefs. And that's what the child knows initially until they become involved with other children and other families. The primary goal in caring for the child with cognitive impairment is to what? You have a child who has cerebral palsy, so definitely cognitively impaired. What do we want for that child? So we want to promote that optimal development. You know, I have seen with early intervention, children with Downs or children with autism, they are so far ahead of another child who didn't have that early intervention. You know, to have a Downs child with the tongue not, you know, sticking out and able to feed themselves and dress themselves, etc., because of early intervention, it's absolutely that. Promote optimal development. And then once you reach that goal, go to a higher one, go to the next one. What is an example of cognitive milestone for a toddler, ages 1 to 2? What should they be able to do cognitively? What should they do? Well, for sure, they should be able to, and they love to please. Remember, they want to put their clothes in the laundry basket or their shoes by the front door. or put your napkin in the garbage. They should be able to do very simple little commands, and they want to do that because they are pleasers. What is the best practice for school-age children with special needs? I mean, I know what happened when I was in school many, many years ago. And the whole thought process of how to work with these children has completely changed. You know, just because they have a special need, does it mean that they're cognitively delayed? No. As we go forward, we're going to listen to a diagnosis about myelomeningocele. And all it means is the spinal cord was born on the outside of the body, had to be surgically, placed where it should, but there is very much weakness or even paralysis of the lower extremities. So if they can't walk, they're in a wheelchair. Does that mean that they're not normal in their brain? No, it doesn't. So they should be integrated into regular classrooms. And it also makes these children want to do more and be better. Collecting a heel stick blood specimen on an infant can be made easier to collect by how? We don't always stick a needle into the intracube and get blood, unless it has to do with a bleeding profile. But CBCs, your chem profiles, all can be done by taking a heel warmer, hospital approved, putting it on the heel, heating up that heel, hanging that leg down and squeeze gently, very gently, because you can bruise those heels very, very easily. And to get a CBC and a chem profile, it's 1.2 mLs. It's very little, and you can do it with that. So hospital approved heel warmer is the best. Everything dilates and the blood flows easily. Children can show signs of stress by being incontinent. Yeah, no. We know they can scream and yell, or they can get to the point of regressing, but do they go incontinent? And absolutely, yes. That's what children do. They show you in ways like regressing, which is being incontinent. Jamie's on fire. Referrals for cognitive impairment should occur when you realize something's going on. That child, that infant's not doing what they should be able to do. When should you put that child in for a referral for going to physical therapy or speech therapy? And it's like as soon as you see it, because children are so resilient. They will gain a lot of the things that they're behind on just by being taught again by speech, physical, occupational therapies. A client with a mild intellectual disability. Remember, children that are born with intellectual disabilities like Downs or cerebral palsy, many of them can go live on their own, right? But they're going to need somebody to watch over them. And these clients, these children can live a long, long, long time. So it's getting them prepared to be able to be independent and live on their own and not be abused, because these are people that will be abused. There are people who like to go out and find these adults, young adults, and take advantage of them. So teaching them all about that. Which cognitive impairment is due to an extra chromosome? And that's your Down syndrome, absolutely. Down syndrome, and I've seen children with Downs mild to severe, and I've seen Down children do an incredible things that you would never think. And why? early intervention. Down's children have frequent upper respiratory infections. Why? And it's because of the nasal bone. You know, yours sticks out on top, theirs smushes in. And then what happens? That mucus sits there and it becomes collected, and then they drip, and that creates the cough, the congestion, etc. It's that nasal bone. Very good. A multi-select. What would be included in the plan of care with a child with moderate cognitive impairment? And it's everything. So number one, being on a schedule. They know what's coming next. Then there's many children, cognitive impairment, they're autistic. They don't like sights and sounds and noise, and to expose them to those things slowly, they can become used to it, and it's not going to be that much of an issue. And of course, toys that you can teach that shows them something. So all of those things we can use. A multi-select. Why do children with Down syndrome have frequent respiratory infections? And it's all about that underdeveloped nasal bone. Yes, it has to do with their mouth breathing all the time and stuffy noses. A tongue doesn't really bother those respiratory infections. You know, and I was working at this pediatric prescribed daycare. It's called a PPAC, and that's where I did clinicals, you know, with the ground school, Cutler Bay. And this facility has a lot of children, infants to toddlers, that have Down syndrome. The one thing I noticed immediately, because of early intervention, these children, Down's children, weren't there with their tongues hanging out. Their tongues were always in their mouth. Why? They were taught by speech therapy. They were taught to keep it in their mouth. And I thought that was very impressive. So children, and these were like 3-month-old twins that were doing it both, tongues in the mouth. What are some clinical manifestations a nurse may see in a child with Downs? So they have that flat face, they have this, you know, ears are down, and they got a tiny nose with the flat little bridge there too. And of course the tongue. And those almond eyes, I think they're beautiful children. Multi-select. Autistic children demonstrate which behaviors? So autistic children do not like to be touched. They don't like lights. They don't like people, crowds, sounds. So what would you see? Well, they're not going to be speaking, talking, you know, as much as another child of the same age. They're not going to look at your eyes. They do like to sit in the corner. They like to play with themselves. And they get in their little world, so they're not even going to respond to their name, because they are playing by themselves, and they'll do repetitive behaviors. They'll take a truck and put it on top of a block, and they'll take a block and put it on top of the truck, and then put something on top, and then they'll take that on top, take the block off, take the truck off, and repeat, 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 repeat. So I've watched this with children with autism. A multi-select. Fragile X causes. Now, Fragile X is the second type of most popular cognitive impairment. It's like a Downs, but it's not completely. The Fragile X tends to have more emotional outbreaks and requires to be on medication because of these outbursts. Downs don't, but the other places are similar. Intellectual disability, learning difficulties, and physical deformities. There is no diet anything on these Fragile X. They just need medications to keep themselves calm and from having these outbursts. Causes of autism. Why does it happen? We know autism is boys, and we usually don't diagnose it till about age 2. I mean, many years ago, this physician wrote a false research paper, and it was about that chickenpox vaccine caused autism. Now, how did that correlate? Well, we give the varicella vaccine about 18 months, and sometimes a little bit later if you're behind on your immunization. So it's right about age 2. So this physician decided, well, it must be this vaccine. So of course it's gone ahead, it's been proven, no, it doesn't. This physician lost his license and it's been recalled, but it created a lot of havoc for a lot of parents. But there is nothing that causes autism with immunizations or vaccines. It has to do with genetics. They don't know, something in the brain. They're still unaware, but it is mostly boys. About the age 2 they're diagnosed. Ways children with hearing impairments communicate with each other. It's amazing, children can sit next to each other and they can understand. And you sit there and go, I have no clue. It's everything. Sign language, finger, lip reading, everything. Amblyopia. What is that? Well, something to do with the eye. Amblyopia is what we call a lazy eye. That means the eye is not going to be directly ahead like the other one. So how do we correct this? What's the treatment? Well, the muscle is weak and the eye that's lazy. So cover the good eye and let the lazy eye work. And you take the patch off and on during the day, and that's the treatment for it. And Jasmine's on fire. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? A preschooler, you know, those young children, ages 3, 4. And again, just let them play with this stuff and they're going to be less apprehensive. And of course, first you go in, you make communication, break the ice, and then you start to explain on their level what you want to do and let them play with it. What child may be more stressed when hospitalized? So believe it or not, it is that child who is in the hospital in and out. They could have had a bad experience. Give me an example. All right, how about that child who has sickle cell disease, who comes in and out due to pain and needing antibiotics and IVs. And many of these children, you know, they're African American, so they're dark skinned. It may be a horrible IV stick, and they're just, oh my God, now I've got to get my IV stick. And is the nurse going to be able to get it in there? And that could cause a lot of stress in this child. Or some situation could have occurred in one of these many hospitalizations. So that could cause them. And that's why children who are always in a hospital or in and out, they're more stressed. They know more. A toddler has a hard time fixating on a single point, and the child's eyes cross the midpoint. So he's looking with the eyes crossed, trying to focus and get to where they want to see. What is that called? Crosses. You know, binocular vision and the infants, one eye, they don't meet. It has to do with depth perception. But this is something, and it's called strabismus. It has to do with the eyes can't focus. Then, of course, with strabismus, how can you do that depth perception? You can't, and your eyes tend to also move with that too. Trying to get it there, trying to make it work. What can help the parents to make a baby swallow their medicine? So you have an infant, a toddler, needs to take medicine. What are you going to tell the parents? Probably one of the most asked questions for children that don't like their medicines. How are you going to do it? So if you can get the medicine in their mouth, okay, maybe a syringe squirting it to the side of the mouth, never in the back, they'll choke, they're going to vomit on you, guaranteed. You put it on the side, get it in, and sometimes you have to hold their cheek slightly, okay? But then you tell the parents a big in their mouth. It scares them, and they swallow, and it works really well. I used to do it as a nurse, but now with COVID, we don't do that anymore, right? Things have changed. Treatment for amblyopia involves, I just told you, what is it? So amblyopia is a lazy eye. We cover the good eye and let the muscle of the lazy eye get stronger and work. What is a cochlear implant? You know, many children are born without an ear canal, or they're born, they can't hear at all, or they're premature and their hearing was absolutely damaged with these medications. And they have to get to the point of using a cochlear implant. And it's a device that connects to the outer skull. They actually click it into place and put the hearing thing in, and they're able to hear. Many of these children for the first time ever, but a cochlear implant is a great invention, and children do very well with it. The nurse is discussing sexuality with the parents of an adolescent with cognitive impairment. What's important to talk about? Remember, these sometimes children with cognitive impairment become adults that will live on their own. So talking about sexuality is very important because they don't know right and wrong touch, right? So we need a well-defined, concrete code of sexual conduct. So they know if somebody's done something wrong, they know they need to tell, whoever they're told to tell. A multi-select. A child is asking mom about his sibling in the hospital. How can you alleviate his fears and stress? Remember, there's kids at home too, and their brother or sister is in the hospital. And many times these kids are shuffled between aunts and uncles and friends and grandma and grandpa, all because their brother or sister is in the hospital sick. So I have found that the kid in the hospital, have them make a card for him. Let them write something or draw a picture for him. Or, today we've got FaceTime and all that good stuff, but Also getting that card is something concrete. And then let the kid know what he's going to see when he comes. It's not all going to be pretty. They might have tubes and IVs everywhere. And last question, what types of play allows children to express their fears of hospitalization? Now we talked about, being abused. We can do play to look at that. We can look at play for going for a procedure, but we also can use play for the child to say, this is why I'm scared about the hospital. And it's called dramatic play. Very good, guys. Let's see how we did today. Number 3, Jamie, good job. Number 2, Lauren, good job. Number 1, whoop, 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 whoop. Jasmine, all the way through. And number 4, Q and Jess. Good job, guys. Not bad for having that for an exam week, right? Everybody, please sign your attestations. You were here, you saw a class. I want you to get credit for it. Again, there's some people who've sent me a message for their grades. I will be sending them out before I stop tonight. And it will be Friday. You'll get your exam grades completely. Any questions, anybody else? Anybody need anything? Yes.
Again, how did you say we should ask for our grades?
Send a message in Canvas.
In Canvas, okay.
Yes,
Thank
please.
you.
You're welcome. Anybody else? Goodbye, guys.
Thank you.
Have a good night.
You too.